Hello and welcome to a new Top Doctors online interview with the leading experts. Today we're privileged to be joined by Ms Monika Kaushik, highly esteemed consultant, oncoplastic and breast surgeon, to discuss the modern management and surgical advancements for breast cancer. Welcome Ms Kaushik and thank you for joining us here today.
Thank you very much and thank you for inviting me today.
Would you like to start by introducing yourself and telling us a bit about your areas of expertise?
Yes, thank you very much. So my name is Monika Kaushik. I work as a consultant in oncoplastic breast surgery. I am a consultant at the University Hospitals of Leicester NHS Trust in the United Kingdom. I have private practicing privileges in Spire Leicester Hospital, Spire Nottingham Hospital, and Nuffield Hospital. I also work in a private clinic called the Health Suite in Leicestershire and Nottinghamshire areas. And my areas of expertise is breast cancer management and cosmetic breast surgery.
Thank you very much, Ms. Kaushik. We'll get right into today's topic then, which will focus on the modern management and surgical advancements for breast cancer. So our first question is, what is a modern approach to breast cancer management? Who and what does it involve exactly?
So the modern management of breast cancer is evolved over the recent years, and we look now at modern management in a multidisciplinary team approach, and it's a very individualized approach. It starts with having a multidisciplinary clinic, which is normally a one-stop clinic where the patients are seen, or they're seen via the screening pathway, but eventually when the results are confirmed, they are seen in a multidisciplinary team clinic where the surgeon will see the patient, give them the results. We talk about an individualized way of treatment. And the other specialties that are involved in this is the radiologist who does the investigations, oncologists, and also the pathologists. So it's very much a team approach, and it's individualized to the patient. It can be most of our patients are women, but breast cancer is also seen in men.
Mm-hmm. Great. And besides an increased cancer survival, what is the objective of modern management of breast cancer and how is this achieved?
It is similar to what I replied in my earlier question. It is achieved by actually discussing about the patient in a multidisciplinary team meeting. And then when we talk to the patient, there are various ways of treating breast cancer, even surgically. We talk about reconstructions, we talk about oncoplastic surgery, which is a technique in which plastic surgeries techniques are involved in giving a better cosmetic outcome to the patient. But a lot of focus is also put on what the patient feels is best for them or her in her surrounding. And it may well be that we may think this is the best outcome cosmetically, for example, in a patient. But if her circumstances don't agree, she feels that may not work in her circumstances, then we go and I personally will talk about their day-to-day activities, how they what is more important to them in their day-to-day activities, what emotionally they're feeling about all of this. So it's more like a holistic approach, and that is what is coming up in the modern management now: individualized holistic approach to breast cancer treatment.
Fantastic. Following modern management for breast cancer, we will now move on to surgical advancements for breast cancer. What are some of the advances in the surgical treatment for breast cancer, and how do they benefit breast cancer patients?
Okay, so the surgical improvements have taken place over the last 5 years. And even before that, we've been moving towards de-escalating the surgery, and that can be in the breast and in the axilla. So when you do the surgery for breast cancer patients, the aim is to preserve the breast so they have better quality of life after the breast cancer treatment is over. And therefore, there are newer techniques for doing that by evolving oncoplastic surgical techniques in this. And one of the major techniques that have actually got very we're promoting those techniques are actually saving the breast when the cancer is in a larger area of the breast by doing sort of semi-reconstructive work to build the breast, but not taking the whole of the breast out. The other methods in which the breast needs to be taken out, there are newer ways now of actually, there are newer technology available to have for the woman to have reconstruction at the same time. This has been done for many years, but we are getting more and more newer technology and newer techniques to do this so they can have a better quality of life. It's not just about making the mount, it's also about feeling natural and feeling normal after that. So I would say there are these two techniques are very important, and patients are accepting this with better results.
Out of these two techniques, from your medical perspective, which one would you say is the most promising?
I think both are promising in their own right, because the indications are different. So if a lady unfortunately has to have a mastectomy, and then there are options available for her to reconstruct the breast and feel normal again, which is a longer pathway. But the other technique where we can conserve the breast in other circumstances when they would have to have a mastectomy is something which is fantastic because you can save the breast and still have good outcomes with cancer management, and have good cosmetic outcomes, which causes better quality of life for the patient. So I would say that both these sort of techniques are good in their own right. The indications differ.
Mm-hmm. And Ms. Kaushik, when is surgery not an option for breast cancer?
When is surgery not an option? For early breast cancer, surgery should be done, because that is one of the ways in curing breast cancer with the medical treatment that is available. Surgery may not be an option, unfortunately, if a patient develops metastatic disease. Even in that circumstances, sometimes surgery is done to improve the quality of life for the time that they would be there and receiving the treatment. But that is mainly the relative contraindication to surgery if a patient unfortunately has widespread metastasis, which is never a good thing for us and for the patient.
And to conclude today's interview, Ms. Kaushik, in your experience, how important is communication between a doctor and a patient, from diagnosis to treatment to follow-up care, for prognosis and quality of life?
That is the most important thing in seeing a patient. Communication is on the top. It's very important to communicate with the patient, and with their approval, also communicate with their family. A lot of patients will get their partners or their children, and it's important to understand what they're going through with the diagnosis. It's not just about me being a doctor and talking about removing the cancer. It's about emotionally how they can be strong and how you support them emotionally. So it's a very much a holistic approach, being considerate to what they feel would be right in their life personally, and how they would approach with it. So so I would say communication is absolutely important, and the first thing that we need to be doing properly from the start, even before the diagnosis, and till the end, when they've had the treatment and we are following them up, they become a part of our lives. We become a family with them. So it is really important. I can't stress enough.
Thank you, Ms. Kaushik. That's all of our questions for today. It has been a pleasure to have you. I would like to thank you for taking the time to explain the holistic modern management to breast cancer in such a clear and comprehensive way for everyone. I would also like to remind our audience that if you're looking for expert management for breast cancer, or simply wish to know more about the latest developments in breast cancer treatment, do not hesitate to visit www topdoctors.co.uk, where you can find out more about Ms. Kaushik and book a consultation with her. Many thanks, Ms. Kaushik. It's been a pleasure.
Thank you very much, and thank you for allowing me to speak about this topic that I'm passionate about. Thank you.
Thank you.